Another key stat that the state is now reporting is the number of people who have recovered. News 13's Stephanie Santastasi shows us which criteria must be met for a patient to fall into this recovery category.
We discovered today that finding out exactly who's recovered is complicated. The state actually estimates those numbers. At last check, 11,637 patients are presumed to be recovered in North Carolina right now.
We are updating our recovery numbers once per week.
In a media briefing this afternoon, North Carolina's Health and Human Services Secretary, Dr. Mandy Cohen, addressed the recovery numbers on the state's website.
We know that folks are recovering every day from COVID-19. We wanted to give folks a sense of that estimate.
Dr. Cohen says North Carolina estimates a median time for patients.
For folks who are not hospitalized, we make an assumption from the time in which your test comes back, from the time your sample is collected for 14 days, we assume that you are recovered at the end of those 14 days.
That number increases for patients who needed to be hospitalized.
So we make an assumption that its recovery takes 28 days.
At a local level, we found a similar process is used or will be used in the future. In Henderson County, health officials report they're not currently posting recovery rates due to the challenges in obtaining that information. However, they do plan to post presumed recovered numbers soon, but plan on going with the 28-day mark regardless if you required a hospital stay or not.
I will note that CDC has not put out any official guidance on how we should be calculating that estimate, so this is our best attempt at doing that. If the CDC does change the way in which they are estimating, then we may need to change our estimates as well.
Maniconio's Pizza here on Biltmore Avenue is doing a solid takeout business. But the owner here says that even if he is allowed to open the rest of his restaurant during phase 2, that could start on Friday, he is not going to allow dine-in service anytime soon.
I think indoor dining, it's going to have to be on hold for us.
Owner Mike Napolitano cautious, aware of COVID.
Maybe having some patio service, but we'll probably stay with the window service for the time being.
Mike says he's already working to space patio tables 6 feet apart.
I own Urban Burrito. We've been here in Asheville for a little bit over 18 years now.
Chad Bright will be listening for phase 2 rules.
And I think the minimum will be that they will start letting us have patio.
Restaurants are being very, very cautious.
The director of Asheville Independent Restaurant Association has heard phase 2 will include dine-in options.
We've heard anything from 25% to 50%. There are restaurants that are looking at plexiglass and dividing spaces.
In Montford at All Day Darling, the owner is doing long-term investment for space.
We're changing the entrance and exit in all of the restaurants to make the traffic flow easier.
Jacob Sessoms owns several Asheville restaurants. His indoor dining at all of them also on hold.
We have to stay, 6 feet away? I mean, how far apart are we?
That was 67 days ago, sitting face to face with VIA Health Chief Medical Officer Dr. Craig Martin. Okay, first thing, little did we know. Today, it's a follow-up story via Zoom. Social distancing to an extreme.
We didn't know quite what the new normal was going to be, and in some ways there's so much uncertainty we still don't know what's going to happen.
What has happened in many cases can be illustrated with these blocks. The pieces of our psychological puzzle are tested. Stuck in close quarters with loved ones. For how long?
Human beings were not meant to be socially isolated for more than 3 to 6 to 9 to 12 months.
Fear of a virus that's spreading.
We're now approaching, over 90,000 deaths.
Anxiety over work, school, socializing again.
As we start to open up a little bit, that comes with some risk.
Concern can hit close to home.
My brother, who's in a nursing home, one of his roommates contracted COVID-19.
For some, it becomes just too much, overwhelming. Alcohol and drug abuse, even an increase in suicide.
I think it's probably out there and it's probably growing. There will be likely a curve or a wave after this.
Dr. Martin says seek help right away, that self-help is often enough. Take a break, exercise, relax. Stay informed, but avoid the bombardment of bad news. Seek alternative programming for your brain and trust we'll get out of this.
The strength of the American nation is our independence. And sometimes it may also be our weakness because sometimes we're a little impulsive to want things too quickly. So I guess the caution I would have is for us to take time and not get ahead of the science. And with that, I think we can have a lot of hope about our future.